Hello, everyone. My name is Dan Dowd. I'm a medical science liaison at Genomind, Incorporated. Today, I will be presenting this webinar titled Common Genetic Variations Associated with Psychotropic Drug Response and Side Effects. Some details regarding my background: I am a PharmD and support clinical engagement and medical education efforts at Genomind. As some of you probably already know, Genemind is a personalized medicine company that is bringing innovation to mental health care through genetic testing. The Genecept Assay is a comprehensive laboratory-developed genetic test. It provides licensed and prescribing clinicians a tool to use based on their patient's genetic information that may help guide personalized treatment. Genemind is proud to join others across the country in recognizing May as Mental Health Awareness Month. We at Genemind feel that this is an important opportunity to spread the word that mental health issues affect millions of Americans. Part of understanding mental health issues is realizing the progress that is being made through effective treatments. This online webinar can be accessed anytime and informs clinicians, patients, and the public about genetic testing to help guide mental health treatments. Also, with this webinar, we would like to bring attention to the fact that many neuropsychiatric conditions are left untreated or treated suboptimally utilizing the current treatment as usual methodology, and very often patients experience residual psychiatric symptoms. Here we have some mental health facts according to the National Alliance on Mental Illness. Mental illness is highly prevalent in the USA, and millions of Americans are affected by common mental health conditions every year. For example, nearly 18% of the population is diagnosed with an anxiety disorder. These patients and their caregivers live difficult lives. Treating mental health conditions is challenging and very costly, as you can see here. Nearly $193 billion are spent every year on treatments in the U.S. In spite of this huge spending, 90% of those who die by suicide have an underlying mental illness. Sadly, suicide is the 10th leading cause of death in the United States. So this slide focuses on studies analyzing treatment outcomes in common neuropsychiatric disorders. This includes depression, anxiety, and bipolar disorder. These studies have been conducted by the NIMH, which is the National Institute of Mental Health, and this is the largest scientific organization in the world dedicated to mental health research. All of these studies converge on the fact that there is significant variance in patient response or remission to psychiatric treatments. Looking at the pie charts here, orange describes the percentage of patients who are not in remission, whereas blue describes the percentage of patients who are in remission. As an example, up to 40% of anxiety patients still have significant symptoms after their initial treatment. This evidence reflects that psychiatric disorders are clinically challenging, hard to diagnose, and even harder to treat for clinicians. So in summary, psychiatric patients show a higher degree of treatment failure, ranging anywhere from 1/3 to 2/3 of the total subjects treated. This may be explained by the treatment as usual model of psychopharmacotherapy. Also, we have referenced some seminal NIMH studies in the slide for your further review. The traditional trial and error approach in psychiatric clinical care is presented in this slide. Often, psychiatric patients undergo a treatment process which spans 5 to 6 months. However, as discussed earlier, a significant majority of these patients do not get better after their initial treatment and even after subsequent treatments. Normally, clinicians will choose a psychotropic medication, evaluate side effects at week 2, and then treatment response at weeks 4 through 6. If there is no significant clinical improvement, the medication is substituted or augmented with another psychotropic drug, and another 4 to 6 week cycle starts from the beginning. This cycle repeats multiple times as trial and error until the suitable medication for the patient is identified. Genemind believes that there is a better way to perform medication selection than the traditional trial and error approach. So we are all the products of our DNA, and human chromosomes are long strands of DNA. We have 23 pairs of these chromosomes. DNA is composed of 4 nucleotide base pairs, known as adenine, thymine, guanine, and cytosine, ATGC. There are approximately 3 billion nucleotides, and genes are sections of DNA that code for proteins. Each person has approximately 23,000 different genes, and 99.9% are identical between individuals. There is only a 0.1% inter-individual genetic variation. This variation may be due to base pair substitution, one base pair replaced with another, or base pair deletion, which is the removal of a base pair or a group of base pairs, or DNA insertion, where a single base pair has been added to the DNA chain. A change in a single nucleotide may have a clinical impact such as modulating treatment response or drug metabolism of psychotropic drugs. It is important to look at individual genetic variations in key genes as it has the potential to help patients get better sooner. Pharmacogenetic testing in psychiatry is an innovative concept. It is well accepted that there is significant inter-individual variation in medication response, and genetics can account for a significant portion of this variable medication response. Pharmacogenetic testing takes a large population of mental health patients and tries to identify groups of individuals that are good responders or poor responders to medications, or identify individuals prone to high or low side effects with the usage of psychiatric medications. Treatment guided by the Genecept Assay may inform clinicians to choose appropriate medications and make therapeutic decisions based on an individual's personal genetic profile. It is an additional resource clinicians can use when selecting clinically appropriate medication based on the patient's medical history and background. The Genecept Assay disrupts the traditional clinical pathway to guide depression treatment or any other mental health disorder. Clinicians with pharmacogenetic information can compensate for a gene or pathway dysfunction, or by adjusting medication dosage to accommodate the rate at which patients individually metabolize different medications. Treatment guided by the Genecept Assay may help patients achieve clinically measurable improvement in 3 months or less, as it is based on individual genetic variants. Now let's focus on a recent study that utilized Genomind's internal HIPAA-compliant database of pharmacogenetic tested patients with mental health disorders. So clinicians of these patients utilized the Genecept Assay from March 2012 to December 2014 to treat mental health disorders. This study is titled Genetic Variants Associated with Response to Psychotropic Medications and Drug Side Effects. And it has been recently submitted for peer review in a prestigious high-impact scientific journal and has been accepted for presentation at scientific conferences. In this study, we are focusing on an earlier pharmacogenetic panel that consisted of 10 genes, as the data for this current study was collected from March 2012 through December of 2014. Here we have pharmacokinetic genes that encode enzymes responsible for drug metabolism, for example, cytochrome 3A4, 2D6, or 2C19. We also looked at pharmacodynamic genes that impact how drugs interact at target sites in the body or the brain. Examples would include the SLC6A4 gene, the COMT-COMT gene, or the MTHFR gene. We recently developed a more comprehensive pharmacogenetic panel which has an additional 8 genes, making Genecept the most clinically informative pharmacogenetic test in the mental health field with a total of 18 genes. Genomind uses an internal HIPAA-compliant database of 25,720 patients whose clinicians elected to use the Genecept Assay from March through December of 2014. We evaluated the frequency of clinically actionable genetic variations, which is defined as any genotype that may have a gene-drug interaction with certain medications, or that may prompt clinicians to consider other therapeutic options that can benefit a patient. So as you can see, these clinically actionable genetic variants are quite common. I'll highlight 3 of them for you now. Almost 75% of individuals carry a genetic variant that is associated with response to common antidepressant medications. This gene is known as SLC6A4, and it's the first bar that you see in the chart there. Another example is that almost 60% of individuals carry a genetic variant that impacts drug metabolism of some antidepressants and anti-anxiety medications. This would be cytochrome 2C19, which is the third bar from the left. And then almost 19% of the population carries a genetic variant which is associated with poorer response to drugs used in the treatment of depression, bipolar, or autism. And this is the DRD2 gene, the dopamine 2 receptor gene. This slide here presents the top 25 psychotropic drugs that are frequently used in clinical practice. The data in this slide is showing the number of prescriptions written for these top 25 drugs in psychiatric clinical care, and this data was collected from IMS Health. It's interesting to note that 23 of the top 25 psychotropic medications have a potential gene-drug interaction with genes assessed by the Genecept assay. Thus, Genecept results can help guide gene-drug interactions for the majority of these medications. The information yielded by the Genecept assay guides the clinicians to make informed clinical therapeutic decisions, keeping their patient's genetic profile in mind. Genecept guides clinicians in personalizing treatments. Again, there are 2 types of genes that we test with the Genecept assay, pharmacokinetic and pharmacodynamic. Pharmacokinetic refers to genes that impact the metabolism of certain drugs. Some individuals may under or over-metabolize some medications based on these pharmacokinetic genes. Pharmacodynamic refers to genes that impact drug effects on the body. These genes affect enzyme systems, drug receptors, or other proteins that may impact drug efficacy or side effects. This slide here presents an important finding of our current study, which is in publication. Specifically, over 80% of patients who have used the Genecept assay were at risk for pharmacokinetic gene-drug interactions. 98.9% were at risk for a pharmacodynamic gene-drug interaction, and when combined, 99.8% were at risk for a pharmacokinetic and pharmacodynamic gene interaction. Overall, psychiatric patients have a high risk of carrying a genetic variant associated with a gene-drug interaction if prescribed psychotropic medications. So the 18-gene Genecept assay provides guidance on 103 FDA-approved medications, and this accounts for about 97% of medications used to treat psychiatric disorders. As Genecept now analyzes 18 genes, we would expect to find an even higher percentage of patients with variations that affect drug response. So let's discuss 3 examples which can help us to better understand how the Genecept assay can help. Depression. So serotonin is an important neurotransmitter associated with mood disorders. The most common treatment for these disorders is an antidepressant, and many of these drugs impact serotonin to improve mood in patients. The STAR-D trial showed us that nearly 60% of patients with depression did not reach remission after their first SSRI antidepressant treatment. Pharmacogenetics may help us identify those patients who have gene variants which impact SSRI therapy. So let's look at a specific example of how 2 genes on the Genecept assay can influence SSRI treatment. A majority of people have a particular genetic variant in a gene known as SLC6A4, the serotonin transporter gene. This is a key gene in mood regulation, and a large meta-analysis of this variant by Parcelli et al. Indicates a risk for poorer response to SSRIs. If one has a particular variation in an SLC6A4, they may also be at a genetically higher risk of side effects to SSRIs, according to a review of STAR-D patients by Hugh et al. Aside from SLC6A4, it is known that some people break down medications at different rates based on genetic variants affecting metabolism. Patients can be poor metabolizers, intermediate metabolizers, extensive metabolizers, or ultra-rapid metabolizers. It would be valuable to know who metabolizes too quickly or too slowly. So what is your genotype? How does that affect your drug metabolism? And are you a genetically fast or slow metabolizer of medications? So let's focus on this Genecept report example. This patient has variations in the SLC6A4 gene, which according to published studies increases the risk for SSRI side effects and suboptimal therapeutic response. This is highlighted with the red circle. SNRIs and atypical antidepressants may be chosen by the clinician as reasonable alternatives based on what is known about these genetic variants. Also, the patient has genetic variations in pharmacokinetic genes, and this guides the clinician to consider appropriate dosage adjustments in certain medications. This is highlighted by the orange circle. The report suggests that based on this particular patient's genetic variations, the yellow highlighted products may lead to poorer results. This inference is based on what is known about these genetic variants at this time. The report provides a wealth of information that may inform or help guide treatment selection, but making the ultimate selection is up to the prescriber. In summary, by evaluating your genetics, we can help guide clinicians to determine which types of medications may work better or have less side effects, what doses of medications may be best for you. Of course, making the ultimate decision is up to you and your clinician. Anxiety disorders. So millions of Americans are affected by anxiety disorders, which make it a very common mental health condition. Specifically, 40 million adults are diagnosed with an anxiety disorder, and about a third of these patients are actively treated by clinicians. Over $42 billion are spent each year in healthcare expenses for these patients. Clinicians usually prescribe SSRIs, SNRIs, benzodiazepines, or gabapentin to treat anxiety symptoms. It's very challenging to know which medication works best for the patient in the first medication trial. So again, the goal of the Genecept assay is to guide clinicians to individually prescribe for patients that have genetic variations that affect drug response. So here's an example for anxiety medications. We'll take a look at different anti-anxiety medication selection based on some pharmacokinetic gene variants. There are several therapies available to treat acute anxiety, and in this case, we look at 3 drugs labeled D, C, or L. While all 3 are reasonable alternatives, there are subtle differences in the metabolism of each drug. Drug D is broken down by a metabolism enzyme called cytochrome 2C19. Drug C is broken down by a metabolism enzyme called cytochrome 3A4. And drug L bypasses this drug metabolism system. So what do you think would happen if you genetically produced excessive 2C19 enzyme or excessive 3A4 enzymes? If you happen to be an ultra-rapid metabolizer or a fast metabolizer of 2C19, you can break down drug D too quickly. Drug D is diazepam. If you happen to be an ultra-rapid or fast metabolizer of cytochrome 3A4, you could break down drug C too quickly, and this is clonazepam. Drug L, or lorazepam, doesn't face this fast metabolism risk, so it may be selected as a better choice for you. This is a great example of genetically guided optimization of treatment. ADHD. So ADHD is a very common childhood psychiatric disorder. Nearly 1 in 10 children is diagnosed with ADHD. Clinicians use stimulants such as Ritalin, Concerta, Adderall to treat symptoms of ADD or ADHD. These drugs are useful but are associated with side effects. While most people are good responders to these medications, your personal genetics may predict a poorer response or increased risk to potential side effects. The COMT or COMT gene has a genetic variation called the Val158 MET polymorphism, which may affect response to dopaminergic stimulants. For further review, references are cited in the slide. More recently, another gene known as ADRA2A, ADRA2A, has been associated with predicting methylphenidate response in children with ADHD. Genecept informs clinicians on both of these genes and their therapeutic implications, and thus can guide clinicians in making informed decisions. So here's a study that looked at response rates to methylphenidate in children with ADHD based on the COMT genotype. And as you can see, response rates to methylphenidate are impacted by your particular COMT genotype. So for example, COMT Val children were the best responders with an 87% response rate, whereas the COMT MET children had a reduced response rate of 58%. So the COMT Val children had a 50% higher response rate compared to the COMT MET children, based on this study by Kurt Story from 2008. So in summary, psychiatric patients have a 99.8% risk of carrying genetic variants associated with poor response, side effects, or varied metabolic rate of certain drugs. A recent evaluation of one-time pharmacogenetic testing showed it to be a cost-effective method to reduce adverse drug reactions. And pharmacogenetic testing can help identify potential risks and provide additional information to help guide clinician decision-making, which may help enable better patient responses to treatment. So let's take a look at the logistics of testing and the process to order the Genecept assay. So the process to order the test is a fairly straightforward one. It begins with a cheek swab conducted at your clinician's office. A cotton swab is rubbed along the inside of the cheeks and gums for about 1 minute. This swab gets labeled with your unique identifier and shipped to our Genomind lab at King of Prussia, Pennsylvania. Once received, our lab technicians extract the genetic information, and our lab director generates your personal Genecept report, usually within 5 business days. Your clinician is alerted that your report is ready via email. The report can be accessed by the clinician through our HIPAA-compliant clinician portal. If preferred, the report can also be transmitted via fax. Once your clinician views the report, they always have access to a member of our Genomind clinical team to discuss the clinical implications of these gene variants. Any clinician with prescriptive authority in the United States may order the Genecept assay. International clinicians also have the ability to order the Genecept kit. There are several options for ordering the test. Number 1, our Genemind homepage. You can visit www.genemind.com to order a test. Our Genemind customer service line is 877-895-8658, and representatives are available Monday through Friday until 7 p.m. Eastern Time. And you always have the option to reach out to your local sales and account management teams. So here's a final look at our contact information. Please feel free to reach out to us with any questions about the Genecept assay. That concludes the presentation. Thank you for listening, and be well.